So I'm excited to get started. So I'd like to officially welcome you all to our talk on whole brain care, the power of health tech. And we have Brittany with us from DigiCare Realize. We have Phil with us from Voices of Alzheimer's. And our talk today is going to dive into some different aspects around brain health, health technology, and how do we bring this down to the personal, individualized level. So if any point in time you have questions, comments, put them in the chat, because we're going to cover some different things today and we want to make sure we can answer those for you. So I would love to get started with Brittany and Phil giving us their background stories, because I feel like with the diverse experiences and what they have to offer, my introduction does not do it justice. So Brittany, would you mind starting with us and share us a little bit about your background, the work you're doing, and possibly why brain health is so important for you?
Yeah, absolutely. Well, first and foremost, thank you so much for having Phil and I, and so excited to be here with everyone who's really interested in brain health and the power of technology. As Krystal mentioned, I'm Brittany Cassin. I'm the CEO and co-founder of DigiCare Realized, and we're a health tech company focused on modernizing care in complex brain disease using artificial intelligence. So basically, we work with health systems so we can ensure routine brain care in a standardized way for all the patients that they serve. And we also provide support with early detection in different cognitive illnesses, so such as Alzheimer's, Lewy body dementia, and we're also hearing a lot in the news because of Bruce Willis, frontotemporal dementia. By background, I've actually been focused in healthcare commercialization for almost 20 years. And one of the things that I really enjoyed about my experience there was focusing on health technologies and bringing them into daily practice. So I actually was on the team back in 2017 that commercialized the first ever digital medicine system approved by the FDA. What's interesting about that product, though, is it was a technology really intended for those that were impacted by serious mental illness. So if you think about, let's say, schizophrenia, bipolar, major depressive disorder, that was really how the product was supposed to help those individuals. And I'll share with you is that I worked on that product for about 4 years, and 2 years in, I had a very powerful epiphany. And I realized, wow, if this technology was available for my family, it really would have made a difference. So my uncle actually suffers from a type of serious mental illness. And I really saw how that impacted my own family. And my own family didn't necessarily have the tools, the education, or really understand how to talk to their doctor about brain health. And really what we started to see was that my uncle didn't necessarily get the best care. And often, like many of those in the US, unfortunately, with mental health issues, jail or prison actually is their best health care. And I think that's what really started to give me the fire in the belly as to how can we use technology and the data it generates to really modernize care so that we can be more proactive and really help those living with a disease, but also their families. So I'm very passionate about using technology to standardize routine brain care and also provide the support for those that are impacted who need extra cognitive care. So that's a little bit about my background and why I'm really excited that it's Brain Awareness Week.
Thank you so much for sharing. And I find it so valuable when people are willing to, be their authentic selves and share their background, as it helps us realize the different perspectives we're all having today when we come into this conversation. And Phil, would you mind telling us your background and sharing a bit of your story today?
Sure. I learned so much about Brittany, and I've known her for 4 years. So that was interesting. 4 years, I think, something like that.
Yeah.
I'm a writer. I started my career as a reporter, a baby reporter at the New York Times, luckily, right out of school. And did that for about 10 years, then went off to be an advocate, professional advocate, first for the American Civil Liberties Union, and then for a major environmental group, the Natural Resources Defense Council. My brain health story starts about 7 years ago when I realized, well, I received a diagnosis of early Alzheimer's. So, and that came about mostly because I was complaining to my family and my husband that there was something wrong with me. And my sister saw something wrong with me, that my brain just wasn't working the way it used to. And my sister saw an ad on Facebook for a clinical trial center saying, "Are you experiencing memory issues, cognitive problems? Give us a call." And I did. And I ended up with a diagnosis of early onset Alzheimer's. And I've been since then, except for a year pause when there was some regulatory fun with the drug, I've been on the Biogen drug aducanumab for the last 7 years. So, and when I received that diagnosis, I knew nothing about Alzheimer's, nothing. I mean, I believe my grandparents very late in life may have had Alzheimer's, but certainly nobody in their 50s. I was 54. Yeah, so Brittany is my alternative brain. So if I get stuck, she may jump in. I was 54 and nobody in my family had experienced this disease that early to our knowledge. So, I knew right away that I was going to want to write about Alzheimer's, and I was probably going to want to advocate on behalf of people living with this disease or other related forms of dementia. And I've been writing about it since then. I've been published many places. I've told my story endlessly. I say I'll speak to the opening of a paper bag if somebody wants me to. I think it's really critical that those of us living with the disease who are still able to tell our stories do so to help reduce stigma and misunderstanding about an Alzheimer's or dementia diagnosis.
I thank you so much for sharing your background, Phil, and recognize that it is a journey through either getting a diagnosis as well as being an advocate and to share that. So the gift you give the world, thank you for that. Leanne is going to put in the chat, we have a link to Phil's blog and some of his writings, and we'll share it out again if you want to check it out. There's some very great inspirational pieces as well as informative ones that help bring in that patient perspective. And so for me, I'm excited for our talk of the three of us today with coming around with Brittany. At the beginning, you talked about, these bigger terms of health technology and those, and it sounds so big, but how do we bring down like the power of what technology can do to an individual person? And you shared the story of your family. Phil, you shared your story. And I suspect that many of us in the room, based on just your statistics alone of brain health impacting 8 out of 10 people, know someone in our close network and may be able to start to understand how some of these terms we're hearing can help support our own brain care and the personalized wellness path we're taking. So I thought we'd start off with just some basics to frame our time together, because health technology may sound very big, but yet we can make it very applicable. So Brittany, I was wondering if you could tell us a little bit about artificial intelligence, or as we might see in mainstream media, AI, and its role in providing us personalized brain care.
Yeah, absolutely. So by definition, I think you could define artificial intelligence really as the simulation of human intelligence using extensive computing power to really comb through data to maybe unlock patterns of meaningful insights that may be a little bit difficult for a human to do in a short amount of period of time. I think one of the things as a little bit of a gift to demystify artificial intelligence has been this big buzz around Chat GPT. And everyone's been able to kind of see the power of these machine learning algorithms can comb through existing data, and then you can ask it a question and then it responds back. And that's a really good example of the power of, artificial intelligence or machine learning. For us at DigiCare Realize, what we've done is we've really harnessed AI to help us really understand the data that's found in patient health records. So just imagine every time you go to the doctor, your data gets captured in a patient health record in that EMR platform of a health system. And so what we've done is we've designed our technology to be able to comb through all that data. And there are different types of data. So there's a little bit more of this structured data, which would be like your medications, your maybe previous diagnosis, your demographics. But what's really unique about the model that we've built is that we've trained it on natural language. And so what this model can do is very quickly process all of the medical notes of years of medical notes in a patient health record. And that's what we're able to then process. And for each individual in a standardized way is that we're then able to identify, those individuals that are on track with their brain health and those individuals that may need a little bit more cognitive care. And we're able to identify, in fact, those cases of perhaps cognitive illnesses I mentioned earlier with about 80% accuracy. And what's unique about the power of AI is that we actually are not saying necessarily where people are today, but it's predictive. And so we're able to look at who's at risk and really give people more time in understanding their brain health. So maybe that they can start changing some of that trajectory. So that's really kind of the power of how we see, AI being used in our own brain care.
And I'm so grateful for you explaining that to us, as well as with Phil here, is because I'm thinking, Phil, could you tell us a little bit about, you're working as an advisory board member with DigiCare Realize, and you're understanding some of, I want to say, access challenges that have occurred over the years. Could you give me an example of how AI would have supported or can support your own brain care?
So I can't say how it would have, because I don't think it was used, but certainly could have. The latest thinking is that the buildup of plaques and tangles in the brain that will ultimately begin to cause cognitive issues can be building in your head for 15, 10, 20 years beforehand. And that, you don't just wake up one day and say, oh, I have Alzheimer's. This is something that's developing for a long time. And the latest medical advances, and there have been actually some medical advances, shockingly, in the last couple of years, which we hadn't seen for a very long time, really do rely on people getting that early knowledge, getting the sense, the knowledge that something bad is brewing in their brains. So, I envision, I like to say I'm a walking comorbidity, right? They talk about things that may ultimately indicate that you could experience dementia. They talk about blood pressure. They talk about depression. They talk about, I'm blocking on everything else, but they talk about everything basically that I have. And, had a system like Brittany's and DigiCare Realize been in place, possibly my doctors could have said to me, Phil, something bad could be brewing in your brain. We better get it checked out. And, had there been a medication available 7 years ago, not in a clinical trial, but approved and ready to go, my doctors could have said, this is troubling. And we got you the PET scan and we see that the amyloid is beginning to build in your brain. That's one of the clear signs that you're going to be impacted cognitively. Why don't we start this medication for you and clear that problem out and see if we can delay or maybe even possibly stop the development of a cognitive illness? You know, in comparison today, using existing practices and technologies, I just had my physical, my Medicare physical, and the doctor gave me a cognitive test. Repeat these 3 words, she said. That was my cognitive test. 3 words. Not even a minute long test. That's just ridiculous, right? And, you know, I have written many times about the existing cognitive tests that are out there, the paper tests. And, you know, I acknowledge that I failed one and have failed them, but they're not very sensitive. They're not, you know, you're not going to get a lot of knowledge out of them. Now, increasingly, there are computerized tests that I've been able to play with and explore, and I can see they're going to be more powerful. But again, you have to be told to use one. You have to have a doctor say, you know, something's not right here, or something could be wrong. So I want to send you off for this test. And maybe it's even a precursor to spending the money on a PET scan. You know, maybe there's this buildup of, okay, we want you to take this cognitive test. We want you to, and see how you do. And then if you don't do so well, maybe we'll have you get the PET scan, and then maybe we'll put you on the medication. So, you know, what the system that Brittany, see, I present well, but I do have issues. The system that Brittany is bringing forth to the world takes out so much of that human, you know, possibility of mistakes or being, you know, forced to, doctors don't have time to do, they don't understand cognitive. You know, let's let the computers do what they do best and sort of work in the background and say, hey, something's going on here. You may have a problem. Let's get it checked out. Doctors are very good at prescribing. I don't think so many of them are very good at diagnosing, actually. You know, so I think that's an interesting way, and having the computer say to us, there's an issue here, we should check it out. Yeah, I think that's where I'll stop babbling.
Well, thank you both so much. And hearing your perspective to the questions we've just had, it's really the general shift in healthcare is we want to go to prevention, but we don't do that piece really well. And so how can we use strengths like AI or health technology to, just like you said, start on the prevention and help give people support earlier or to diagnose faster? And we have lots of different ways that's happening. But Phil, I'd like to follow up on your experience and where we were talking about like today's brain care. So Brittany, I'd like to start with you though. And can you tell us a little bit about how do we measure cognitive care?
Yeah, absolutely. I think Phil just kind of touched on it, obviously from his own experience, but I think you start to see different ways based off different preferences providers have. So I think one of the most common where we are today, and perhaps maybe the least sensitive when it comes to early stage, is this idea of clinical interview and observation. So we'll get asked a series of questions by providers, but it's not standardized and it may kind of fluctuate. Now, this actually kind of works well if you're looking at more later stage. It can really kind of uncover some of those later stage cognitive illnesses, not so much early. And, you know, then you start to kind of see these different tools that are more paper-based built. And these end up being more standardized questions. And maybe you've even heard of some of the names where they're called like MiniCog or MMSE or MoCA. But again, their interview and their subjectivity and how they're administered. Oftentimes you kind of would prefer the person administering them, they're trained. And Some cases they kind of fluctuate in the way that they do the administration, and it's not a true objective read. Phil just actually mentioned some of the digital cognitive assessment tools out there. And so, I encourage you to look at different companies like CogniView or Linus Health are really good examples of different digital cognitive assessment tools that really are innovating. And the goal really becomes providing this standardized measure of cognitive status. But, one of the things that I kind of think about too is these tools also require a patient visit for the most part. They require that provider and patient interaction. And one of the things also is that given where we are as a country, where you start to think about the different types of populations that health systems are managing, we're starting to see different types of, let's say, non-speakers or different levels of education play a role in how well these assessments are. So I'll give you an example of my own grandmother. My own grandmother actually spoke Spanish only. And so unless her doctor spoke Spanish, my grandmother wasn't going to get a cognitive assessment that day. So really, tools like what we're doing at DigiCare really kind of look at how can we modernize cognitive care for all populations and really think about the person first and what's needed to kind of better assess our cognitive status.
I appreciate you sharing that of kind of where the tools are, but as much as it alludes to the fact there's this whole patient experience around cognitive screenings, the administrations of tests. Phil, would you be willing to share your experience with cognitive measurement or cognitive
Sure.
care, if we want to call it?
Sure. I mean, it's how do I say this? So much of it happened 7 years ago, and it was a crazy time. And I don't remember a great deal of it, but, and as I say, I failed. I failed the tests, even though, I knew something was wrong, but the tests they gave me felt so surfacey, superficial that, it surprised me that I failed them, I guess, let's just put it that way. And, I wonder had, I've been having a better day, or maybe, if the questions had been slightly different, would I have failed? Would that have been enough to put me on a path to trying to take care of my brain, through the drug trial that I was on and through the activities that I've taken? I'm reminded after I got my diagnosis, I went to my then primary care doctor, and I told him that I had received this diagnosis. And he literally yelled at me, told me that I didn't have Alzheimer's, and basically showed me out of his office. He just could not, or, he was an older gentleman and probably hadn't been in school in a very long time. And, I'm getting a visitor. Say hi to Missy. Hi, Missy. Say hi to everybody. And there's so much stigma about this disease. And, the knowledge that you're going to face skeptical doctors and people who would yell at you and say there's nothing wrong with you, it's not going to help us. So again, I just love the fact that there's a computer system working in the background saying, just looking to make sure that your health care, that your brain health is being considered in ways that a doctor most likely is not gonna know to look for. So, that's what is so exciting about the future of the technology and things like that, because, there's the computerized cognitive tests that are so much better than the paper ones. There's the product that Brittany is developing that's going to be working in the background. And you begin to see that in a couple of years, assessment and diagnosis is going to be a completely different experience than what I went through. So a decade, which isn't a very long time. It feels like a long time, but it's not a very long time to see this kind of wholesale change in how we begin to care for our brains is so important.
And that's one of the main reasons I'm so grateful to be having this discussion with the two of you today, is it's shifting that perspective from individuals and wanting to seek access to routine quality brain care. And so I'd like to dive in a little bit deeper with both of you in your own respective areas with my next question. And Brittany, you've worked expansively and extensively in health tech. So how would you explain how our health tech data is actually used to improve our lives, either now or maybe where we're going in the future, because you're the in-house expert?
Sure. I mean, there's so many ways that this technology can be applied, but I think one of the things, especially about what it means to me, right? Like there's so much going on, but I think at the end of the day, how can it really improve our own personal brain health as individuals? I think about where we were years ago with maps, right? Like bear with me. I don't even know if anyone actually has a map in their house, but back in the day, you'd open it up and I don't even know how we drove safely. But you think about how technology has really revolutionized how we get to destinations or how we travel. And then you think about how the power of the GPS alone, whether it was in our cars or now it's in our phones where it talks to us, or it reroutes us when we're kind of going the wrong way. And you really start to think about the power of technology has brought in efficiency, safety, and keeping us on track. So when I think about that analogy, it's like, wow, look at what, if you apply that technology to our brain health, imagine what that can do for us. And I think what I love about what Phil's talking about too is like, if you start to have these cues early on, you can stay on track with your brain health. And even more importantly is that when we start veering off track, we can start to put in these modifications and really practice more self-care. I think one of the things that makes brain health a little challenging with other maybe diseases or other conditions or other things we need to consider is that the organ reporting is actually also the organ involved. So being able to take data and use that to help us stay on track is just so powerful. And, I think us really embracing the conversations about our brain health and being curious and then seeing how these tools can help us. I mean, it really starts to put a different spin on being more proactive and, having healthy aging in brain health.
I'm going to make sure I work on that narrative you just said, because I thought it was so important, is when you say it's the organ reporting is the organ involved. And we know how complex the brain is, and we know how little we actually know about it. And yet where we're growing and where it's going. And so I wanted to just point that out, as I thought that was a very important point, because if you think about anything else with your body, it's not reporting it on itself. And so there gets to be all these different factors involved. And I'm grateful now we have a better understanding of what routine brain care looks like. And I'm suspecting that many of us are starting to think about there's room for improvement on our own brain care. And so, Phil, I'd like to just ask you a bigger, broader picture, but what is your vision for the future of brain care?
Well, first of all, I'll go back to what you just said, which is, I think we know so little scientifically about how our brains work. It is, I just started, I don't remember what it was now, but I was sitting there doing some YouTubing one day, just flipping mindlessly through things, and I found this lady, a neuroscientist, and she has courses on YouTube. And I started to watch one, and the complexity of the brain and the synapses. I mean, billions of synapses in your brain, which weighs about 3 pounds, right? Something like that. It becomes, what are there, more synapses and stars? You hear these kinds of terms and you begin to think, how can I ever impact that, right? If we don't even understand it, how can I, begin to make changes to impact it? And, it's not easy, right? And there's so much that we don't understand. Some people think that, Alzheimer's is, a multifaceted disease. There's no one cause. It could be inflammation. It could be gut health. It could be, hearing, depression, all these things they're saying are sort of causes of brain health, or brain dyshealth, I guess. And where am I trying to go? I think, it's important, and we hear this all the time. You have to take care of yourself. You have to exercise. You have to eat right. But we don't do it. The vast majority of us don't do it. And, for me, I was not an athlete, and I, spent way too much time from the time I, was in school staring at computers and sitting at desks and stuff like that, writing and reporting and things like that. But when I got to be in my 40s, late 30s, early 40s, I had an exercise spurt, and it lasted, probably till the pandemic, really. I ran marathons. I wasn't a runner, but I decided I was going to be a runner. And what was I going to do? Because I'm an overachiever, I decided I was going to train for a marathon. And I ultimately ended up running 16 of them, in a fairly short period, because I'm a crazy person, and then I discovered CrossFit, and I did CrossFit for, multiple years. And then I went off and I found a friend, started an indoor rowing studio, which is amazing exercise for anybody who is looking for a good form of exercise, the rowing machines. And I did that every day for years. As a matter of fact, I had a streak going, and I think it was in the thousands, of doing some form of exercise every day. And you know what? I still got Alzheimer's. So, there's no one answer. We do need to do a better job taking care of ourselves and taking care of our bodies and our health, and eating better, which is certainly something I could have been doing all along. Except my favorite foods are white pasta, potatoes. I try to be a vegetarian, don't succeed. I don't eat chicken, but it's just, I'm a vegetarian who didn't particularly like vegetables, which is a real challenge, because then you become a pastatarian. But I guess my point is, we need help, right? And that's where the tools Brittany's developing and others are developing, they can help us, right? And as the scientists are finding treatments for, like, we have high blood pressure, there's a pill for that, right? So why shouldn't there be? And maybe someday there will be. You got cognitive issues brewing in your brain, there's a pill for that. Let's take that, and let's exercise, and let's eat better, but not just rely on the guilt of saying you need to exercise, you need to eat better to make changes in our brain health.
I appreciate what you shared. And, from my experiences in working in different spaces with people with wide variety of brain health concerns or conditions, is it does come back to raising awareness and recognizing there's individual choice in some of what we get to do. And it's not always this perfect list when we say, here's your brain health risk, and you won't get to all these trajectories. There's people that are still healthy that have to manage chronic health conditions. And so it's finding that individualized balance at our own personal level. And Leanne, if you don't mind, we talk about brain care as an acronym here at our center. We'll put in that resource handout for you that just looks at some of those researched informed recommendations of what you can do. And we have it on a path in recognizing our journeys are lifelong, and it's going to look different at different times in life. And Phil, I appreciate all the different things you shared that you did, and yet it's at different times. And so having that willingness and openness to try new and different things we know is helpful in general for our health and well-being. So we'll get that for you in the chat, and just so you have that as an extra resource for you. But I feel like we're kind of moving from lifestyle to a little bit of treatments and then shifting forward to what we could do now. And Brittany, I know you have your finger on the pulse more so of like new treatments becoming available, but we're seeing its access being limited to some extent. And so how do you feel that this is indicative of the value we place on brain care, especially for some disease states like Alzheimer's and dementia?
Yeah, it's really an interesting time. And also when you think about from a science perspective or drug development perspective, it's been a long time since we've actually had products come to approvals. And I think when you start to kind of see now, at least we're starting to see a difference between how things are being covered, which then has implications on being able to access these. So this might be a good one that I'm gonna partner with Phil in answering. But I think from my perspective, when you're talking about value, it's very interesting because I think sometimes I'll get asked, what's the value of early detection? And I think we need to kind of decide a little bit when it comes to our brain health. The truth is if we wait too long and we're reactive, we've lost the time to take action. And I always look at it is if you can measure it, then you can look to manage it. And when it comes to our brain health, yes, there are things that you kind of talk about from a diet, exercise, sleep standpoint, but also there's things that give us opportunities to get the best benefit. So as these new drugs are coming out, it is essential that people get the opportunity because the clinical benefit is actually at its earliest, it's in the early stages of benefit. And I think what you start to see is no one really wants to wait, like if it's them. And I think it's really important that we kind of embrace this idea of really being able to manage it. The other thing too is I also don't want to skew too much to this world of like, if there is something like a cognitive illness is detected, because I also kind of think one of the things that we want to definitely do is if we are healthy with our cognitive status, I really also think it's about taking action to stay on track. And, again, it really becomes very individualized, and having access to things that help us stay on track is also just as important. But I don't want to shy away from that tough question that you just asked about the treatments and access. But I think, Phil, this is a really good opportunity to kind of share more about Voices of Alzheimer's, and as a founding member, what you guys are doing, because I think it's so critical given the landscape.
Yeah, thank you, Brittany. And I'll put on my advocate hat now because, an advocate hat and also a patient hat, right? Because for the last 7 years, I have put my arm out every month for an infusion that, I hoped I went into clinical trials knowing that there was very little chance that it was going to actually help me because Alzheimer's drugs had been failing, right? It's a graveyard of potential treatments that, the scientists have been trying to develop for years and years. And, suddenly it turned out that the drug I was helping develop through being a lab rat, I know a lot of people don't like it when we patients call ourselves lab rats, but that's okay, right? I understood my role. It was to try and see if this drug worked. And I did it for my nieces and my nephew and their children to make sure that they didn't have to face a doctor saying to them someday, you have Alzheimer's. And, lo and behold, it worked, right? The drug worked. And it did delay onset of more serious symptoms. And you think, wow, this is exciting. I was part of, a world-changing event. And then insurance and government and messy decisions got involved. And Medicare decided that even though the FDA approved the drug as beneficial for people living in the earliest stages of Alzheimer's, the FDA and the Medicare folks said, we're not persuaded. Unprecedented. FDA drugs are by law supposed to be covered by Medicare. Medicare said, we're not persuaded. We want another study. We don't get it. Then you're on this roller coaster of saying, wow, I was part of this great thing. Oh, but nobody can get access to it now because if CMS isn't going to cover it, if Medicare isn't going to cover it, private insurers aren't going to cover it. And it's an expensive drug, as many new drugs are, right? Drugs, when they come out on the market, are often very expensive. And, but CMS, because they help, makes the decision that they're going to, well, they'll not make a decision. They're supposed to be covered. So, the experts tell us what CMS, what Medicare did was unprecedented and showed, I think, a pattern of discrimination against people living with cognitive illnesses and in terms of what they're willing to pay for and what they won't pay for. One of the staff at the Centers for Medicaid and Medicare and Medicaid Services, CMS, was saying basically, these people aren't sick enough. That's basically almost a direct quote from him. Why should we be spending millions and millions and millions of dollars a year for people who aren't really sick? And, the only way I can describe it is like, you go through the colonoscopy when you hit 50 and the doctors say, well, we found some cancerous polyps, but they were small and you're not sick. So we're going to let you go home. And maybe in 10 years or so, when you really have colon cancer, come back and see us again. And we'll cover the treatment for that. That's the only analogy I can come up with for the way Medicare is treating people living with Alzheimer's. You're not really that sick yet. Come back in 10 years when you've got real symptoms, and we probably can't help you, but we'll treat you then. It's very, very frustrating. And you see folks like the Alzheimer's Association has been very aggressive about this. Brittany and I are actually going to be in Washington next week, where there's going to be a rally in front of the White House trying to seek attention to this discrimination by Medicare against people living with Alzheimer's. And the Alzheimer's Association is doing that. We'll be on the Hill. We've got all kinds of fun events scheduled. Brittany's like, what have I signed up for? Brittany is a wonderful, she's my travel Sherpa. She comes with me and makes sure I don't end up in, don't forget to get off the train and end up in Florida or something like that, which not that bad, but has kind of happened. We did just hear that the Veterans Administration, which is usually more selective than even Medicare, did agree to cover for some people, for some veterans, the second drug that has been approved, lecanemab, and that just happened yesterday, I think. We're beginning to see some movement, but I think a lot more pressure has to be applied. And for those of our viewers who live in the United States, please reach out to your members of Congress and tell them that you want the government to stop discriminating against people living with Alzheimer's. And you can do so from our website, which I saw was up there, Voices of Alzheimer's. And also the Alzheimer's Association, as I said, is very engaged in this and being very aggressive.
Appreciate you sharing a story that seems like it's been a roller coaster ride of highs and lows that is just not easy, but also brings it back to so many situations around access to care, brain health, treatment, routine brain care, and just layer it all in for the key word, the complexity of the brain and kind of the strides we are trying to take with the knowledge we know, as well as wanting to do better. And so hopefully these are things that you're seeing in your news or reading about that now we have a little bit more information and insight on. So I thank you both for sharing your honest and authentic journeys to this point. And I know that you both are doing something about this for yourself. So I've heard rumors and I read a blog that you're doing a brain health action plan just for yourselves to actually try to start this and hold yourself some level of accountability. And the last time we chat, Phil, you had just published this, and I know Brittany is now held accountable because it's in writing. So Phil, tell us about that. What is your current brain health action plan and what are you two up to?
So when I published that, how many weeks ago was that? Not that long ago. I sort of made a commitment that Brittany and I would train for a marathon. I haven't run a step. Well, I've run some, but not very much since that burst of marathoning in my early 40s. And I said that we were going to do that. Since then, I have begun to fear that I may actually be not just living with Alzheimer's, but living with dementia called Lewy body, which is dementia with the added fun of Parkinsonian-like symptoms. So if I do get that diagnosis confirmed, I wonder if I would ever have the ability at this point to be able to run a marathon. But my answer is that Brittany's going to push me in one of those fun three-wheel things while she runs a marathon, and then I will be in front of her going, you can do it, come on, giddy up until she dumps me off a bridge at about mile 23 and crosses the finish line on her own. So I think our commitment, given if our bodies are willing and able, let's just put it that way, is to begin to train for some sort of a race, whether it's when we first started joking, we were going to do a half, and whenever people say a half, you think, oh, a half marathon. We were joking, no, we were going to run a half mile. But our commitment is to try to the best that we can to build exercise into our lives. And we've started doing some walking and talking where we'll, if we have something to talk about, we'll do it while, we don't live in the same community. We'll get on the phone and walk and talk. And I think even that, if everybody could have a meeting where they walked while they were talking, I think that would do amazing things for our brain health. So, Brittany, do you want to talk about how much you're looking forward to pushing me through 26 miles?
Yeah, I was the one that was like, yeah, let's sign up for that half mile. And it's I guess the thing that I've learned, and if you guys are, thanks for being with us. I think what you start to see is a relationship that kind of started more professionally that very quickly turned into a deep friendship. And I think one of the things that I recognize is that brain health, especially with me and Phil, it's not about just like his brain health. I think what it is it really taught me to actually think about my own. And then I kind of realized, look, I'll just put it out there. I'm working on a health tech company and we're in the early stages. I'm a mom of two. That also comes with being a Uber driver to soccer practices for those that may know. You have a lot of demands. And I also think women in particular, we kind of tend to put ourselves last, right? And so I think what I've loved about Phil and I's partnership in our brain health is it's actually being more intentional. And so all these things that he was kind of talking about, like, it's not just about me supporting Phil, it's about us supporting each other. And what's so interesting is he mentioned he's on a medication routine, like he needs to be. And, we actually would call each other same time every day, and I would take my daily vitamin. So what I was reporting to him was, when we don't have those calls, guess what? I'm actually not adherent to my daily vitamin. And so I think really what it's kind of shown me is like being intentional, having that accountability partner, and really focusing on what does that brain health action plan mean for individually and then as a partner. And I think also part of it that doesn't get mentioned a lot is also that connectedness. The chuckle about the marathon, like you hear Phil laugh. It's like, you know what? We laugh a lot. And sometimes that actually just like kind of helps us, we have good days, and sometimes that kind of helps us on days that are not so great. And we kind of we're dealing with some challenging issues as Phil's kind of working through some of this stage of where he is with his disease. But I think what it is the power of that connectedness, that also plays such a role. And, as much as, I'll be honest, as I love technology and I love the power of it, but that human connectedness, that friendship, that's all part of it too. So, it's really been a great opportunity for even me to self-reflect and embrace what does it really mean for me to be intentional about my own brain health. And, not everyone has a friend that writes for a column that will put their name in ink that now all of a sudden they're now committed to a marathon. But hey, if you're a lucky gal like me and you do, you got to embrace it. So I'm not quite sure what year this marathon will happen, but I have no doubt that we will definitely travel these miles together and just get better equipped in our brain health.
And if we can't run the marathon, we'll do the half marathon.
We'll do the half.
Can't do
Absolutely.
half marathon, we'll do a 10K. If we can't do that, we'll do a 5K. If we can't do that, we'll walk a 5K. Almost anybody can walk a 5K, and it's something that Brittany just said, and I know we're running out of time, but I just think it's so important. Laughing, if you get a diagnosis of a brain condition, if you get a diagnosis of Alzheimer's, your life's going to be flipped upside down. There's no ifs, ands, or buts about it. And, what I say is you have to learn to walk on the ceiling. If your life is turned upside down, you need to learn to walk on the ceiling. And part of that is being able to laugh. There's not a lot of laughter in this disease and in this fight for equality and to challenge the discrimination and the ageism and all the things that we encounter with dementia and the stigma. But, you have to be able to laugh. And sometimes you have to be able to laugh at yourself, right? Some of the things you do when you're living with this disease are just kind of funny. It's smack your head kind of funny. If we had time, I could tell you many stories, but we don't. So I'm going to shut up and let you finish.
Well, I thank you so much for your time today and, sharing what a brain health action plan looked for you, as well as how that may ebb and flow and change, and really the need for us to think about if our brain care is a priority, what can we do? And then maybe what's this longer goal in getting there? And life happens sometimes. So we make adjustments, but how to still keep the brain, as we like to say, no pun intended, but top of mind with what we are intentionally doing and how we're spending our time. So I'd like to summarize what you two just shared, because you kind of answered the final questions we had. So we'll have time for a few questions from the audience if you want to stick on for a few minutes. But Brittany, I kind of heard from your comments that your top brain health suggestion and tip is to really tap into the social superpowers of our brain, human connection, and what we can do to be around others to help give us the uplift. And that really, I think, transitions to where my takeaway of Phil's top brain health tip was to laugh, to remember to have laugh, to spark joy and have fun, and intentionally seek out those opportunities with all the health benefits of laughter, and how we can do both, especially when we're around good friends, and tell jokes or just stories of life that happens. And so I thank you both so much for your time today. I saw one question in the chat. If you'd like to stay on, we'll go ahead and answer that. But in the meantime, we're going to get up links to your guys' website as well once we transition. So you will have the contact information for Phil, Voices of Alzheimer's, and his blog. And then for Brittany, you're going to see DigiCare Realize and what they're up to. So be sure to check that out and to follow along. But Brittany, this kind of came on earlier in when we were talking about health tech within systems and some of what you're doing. And so how does the complication of medical records across systems impact certain platforms or portals? Because the comment is that this would be really useful in predictive data. And so is that a barrier we can cross? Is it one you're figuring out? What can you tell us?
Yeah, so no, it's a great question. I think we're on a brink right now of how does the platforms really work with interoperability among the different health systems? I think you hear a lot about HL7 or FHIR. Those end up being interoperability at connections. I think what I've learned is as we're starting to engage health systems, it really becomes a one-to-one relationship. So what we'll do in the beginning, at least as things kind of start to evolve from a technology deployment standpoint, is for every health system, we're going to develop that relationship, develop that connectivity. And then as we go to different health systems, we'll just have to do the same thing until we start to see the power of that interoperability to really then break through so that our technology platforms aren't fragmented. But right now, and it's a great point the individual made, but right now, our health records, a lot of that data is fragmented, it's separated. And so that kind of slows down the opportunity of really looking at those data patterns or unleashing something as powerful as artificial intelligence. So we're not quite there yet.
It seems like for many things, we're making progress forward. And so some progress is progress, some is slower, but we seem to really be, I think, broadly under the brain health space, moving a lot faster in comparison to others, but there's still this time lag that occurs. Anna, I see your question in the chat. I'm going to follow up with you by email because we have a couple list of resources to which I can direct you to. So we could do that. If you have any other question for Brittany and Phil, feel free to put it in the chat or raise your virtual hand. We'll keep an eye out. But I wanted to make sure to wind down our time together and in processing our conversation as we were going through it. And just some of the keynotes that I had that I'd like to just point out again is whether it's Alzheimer's disease, another neurodegenerative disease, a mental health condition, when it's coming to the brain, it is very unlikely that you ever get just a prescription and no one else is talking to you about lifestyle or things that you can do in some way. And I think we're on the cusp of seeing more of that, where when I first started training, I remember working with a clinical psychologist, and she said she couldn't wait for the day where she could have a prescription pad and prescribe someone to go spend time in nature before the first dose was an antidepressant or anti-anxiety medication. And how far we've come in even the past 10 to 15 years of, even when you are given a prescription, we're at least talking about a few things of lifestyle. It may not be perfect. We could always do better, but it's leading us to the individualized recommendations for our own brain health plan. And if we keep in mind, it's not perfect science, but brain health is 90% lifestyle and 10% genetics. So if you're thinking about the things we can do, and I was seeing the comments come in earlier in the chat, when we start them early, and it's just our natural default mode of what we do, how many gains we can have over a lifetime, but also balancing that with the current science that shows even when we take the charge for our brain health, 5 minutes of movement impacts our brain, 2 minutes of breath work. There's these small things we can do that are going to impact us now, have an impact, and can carry us forward. So finding the balance for our own brain care. And so that's really what we do during our event weeks, is bring in these wonderful different topics. I was so grateful to spend the afternoon with you all, Brittany and Phil, as well as all of you in attendance here as part of our growing virtual community, to tackle a big topic like health tech, because it's on the news, it's in a lot of covered stories. And what does it mean when we bring it down to our individualized patient perspective, what we know now and where the field may be going? I hoped you gained some new insights in some way, or just starting to think through the things you're hearing, how it may impact your health, your loved ones, or your community sooner rather than later, was my takeaway from this as well. So Brittany, thank you so much for joining us. Phil, thank you so much for joining us, as well as wearing your multiple hats as a patient and an advocate and a speaker, and all the gifts you shared today. You both are having an imprint on our world around brain health, brain care, and advocacy. So thank you all so much. Thank you to the rest of you for your gift of presence in our time today. We hope to see you again at another brain health event. We have 11 left for the week, so we're early in.
Wow.
And we will be in touch soon, and we'll be sharing out information from today's event as well. So thank you so much.
Thank you.
Thank you.
Thank you,
Take
Krystal.
care. Be well.
Bye-bye.
We'll see you all again soon. Bye.
Bye-bye.